Do you suffer from pain in the back of the knee? Let's break down what could be causing it and how you can find lasting relief. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. As a rheumatologist and expert in regenerative medicine, I help people manage pain and improve their health with personalized non-surgical solutions. Let's dive into today's topic: understanding and treating back of the knee pain. Pain behind the knee is a common issue that can affect people of all ages, from athletes to older adults. It can be caused by anything from overuse injuries to underlying joint or vascular problems. If you've ever experienced this kind of pain, you know it can be both frustrating and limiting. Today, we'll explore the causes, effective treatment options, and when it's time to see a doctor. Let's understand the anatomy a little bit better. The area behind your knee, known as the popliteal region, contains a complex network of muscles, tendons, ligaments, nerves, and blood vessels. The key structures to be aware of include the hamstring tendons, which attach at the back of the knee; the popliteus muscle, a small muscle crucial for stabilizing the knee; various ligaments, which help to stabilize the joint as well, in particular the posterior cruciate ligament; the popliteal artery and vein, which carry blood to and from your leg; the sciatic nerve, which runs behind the knee before it further divides as it progresses into the lower leg. When any of these structures are irritated, injured, or compressed, you can develop pain behind the knee. Let's go over some of the most common reasons for this type of pain. Number one is a Baker cyst. This fluid-filled swelling in the back of the knee is caused by excess fluid in the knee joint leaking into the back of the knee. It's often related to arthritis, a meniscus tear, or chronic inflammation. Number two is hamstring tendinitis or strain. Overuse or sudden injuries can lead to inflammation or tears in the hamstring tendons. Next, we've got popliteal tendinitis. This can occur due to repetitive stress, particularly in runners or athletes. Number four, we've got the posterior cruciate ligament injuries, often caused by trauma, like falling directly on the knee or being in a car accident, leading to instability, leading to pain in the back of the knee. Next, we've got deep vein thrombosis, or DVTs. A blood clot in the veins behind the knee can cause swelling and pain and is a medical emergency. Then we've got osteoarthritis or rheumatoid arthritis. These conditions can lead to joint inflammation and fluid buildup, causing discomfort behind the knee. Then we've got sciatica-related pain. Irritation of the sciatic nerve from the lower back and into the thigh can cause pains in the back of the knee as well. Accurately diagnosing the cause of your pain is key to effective treatment. Here's how we approach it. First off, patient history. When did the pain start? What activities make it worse? Do you have a history of injuries or systemic conditions like arthritis? Next is physical examination. I'll assess your range of motion, strength, and any swelling or tenderness in the area. Can we trigger the pain with specific movements? Do you have any neuropathic findings on examination? Are there any physical examination findings that clearly show what is driving your pain? Depending on the suspected cause, we may also check some imaging. That may include either ultrasound, MRI, or X-rays to get a closer look at the structures involved in the knee. Blood tests are on occasion checked. In cases where we suspect an inflammatory or systemic condition, we'll check for markers of inflammation or clotting issues. Other tests that may be rarely ordered would include an EMG test or MRI of the lower back. May be done if there's suspicion that your pain is coming from a compressed nerve. Treatment options depend on the underlying cause. Here are some of the options we might discuss. Number one, rest, ice, and elevation. These are essential first steps for acute injuries or inflammation. Number two is physical therapy. A personalized exercise program can help improve strength and flexibility, particularly for conditions like tendon or ligament injuries. If those aren't sufficient, then we'll talk about regenerative medicine treatment options, if appropriate in your case. Platelet-rich plasma, or PRP, uses your own blood platelets to promote healing in damaged tendons or ligaments. Prolotherapy, a dextrose-based injection or sugar-based injection that helps strengthen ligaments and reduce instability. And then there's also bone marrow concentrate-derived stem cells. For more severe cases, these cells can promote more significant improvement in damaged tissues. In some cases, medications may be required. For inflammatory conditions like rheumatoid arthritis, psoriatic arthritis, I may recommend anti-inflammatory medications or supplements like omega-3 or turmeric. And then lastly would be surgical referrals in rare cases such as a severe ligament or tendon tear or persistent Baker cyst. Surgery may be necessary. I do, however, always recommend surgery only after exploring all non-surgical options. Prevention is also key here. Preventing back of the knee pain often comes down to maintaining joint health and avoiding overuse. Here are a few tips. To begin with, stay physically active with low-impact exercises like swimming or cycling. Make sure that you also stretch and strengthen your hamstrings, quads, hips, and calves regularly. Use proper form during activities and sports. And of course, listen to your body. If something hurts, rest and seek help if it doesn't improve. So when should you see a doctor? You should consult a physician if your pain is severe or lasts more than a few weeks. You notice significant swelling or instability in the knee. If there are signs of a blood clot, such as warmth, redness, or sudden swelling in the back of the knee or lower leg, pursue evaluation immediately. That could be the sign of a very severe medical issue. If you have a history of arthritis or recent trauma and the pain is getting worse, another reason to see a physician. I would recommend that if you have chronic back of the knee pain, see a physician who's got experience with musculoskeletal conditions, in particular non-surgical musculoskeletal conditions, so they can give you a full sense of not only what your diagnosis is, but treatment options as well. Thank you for taking the time to learn about pain in the back of the knee with me today. Remember, pain is your body's way of signaling that something needs attention. At Chicago Arthritis and Regenerative Medicine, we're here to help you find personalized, non-surgical solutions to stay active and pain-free. If you have any questions or would like to schedule a consultation, visit us at chicagoarthritis.com or follow us on our social media channels. If you like this content, give us a like and subscribe. Until next time, live well and stay healthy.